It's fascinating. And of course, as a massage therapist, you kind of fall in love with the anatomy. You go, wow, this is so interesting that the deep back muscles, in this case the erector spinae, are attaching, this is showing it graphically, like vines up a trellis. And then you really start to understand, okay, the erector spinae, this is called the iliocostalis, the longissimus, the spinalis, you see them pictured here on this side, really creep up. And one of the issues posturally, as well as related to back pain, is that most people lean forward if they do anything. They're at their computer leaning forward, and at their desk leaning forward. They have the postural habit of leaning forward. You don't have many people coming to you as a therapist going, I don't know what happened to my stomach. Because they're not normally bending back. They're almost always bending forward. What that means is that these back muscles have a difficult life, because they're always holding on to you. If my back muscles were to let go, even at this moment, I would fall forward. The reason in this posture I'm staying even somewhat upright is because my back muscles are continually tense, trying to compensate for the fact that my weight is basically falling forward. So as a therapist, what you start to learn is that one of the first things you need to do is you need to lengthen these back muscles and take them that are being kind of pulled up and over and bring them back down. And so deep massage for the back, one of the main focuses is to really lengthen these muscles. So I'm going to start at the top of the shoulders, make a good clear contact with the person, press down a little bit deeper, and then begin the movement through the erectors. Now, a lot of clinical body work and the deep massage that we teach doesn't really use or doesn't have to use lubricant, because what happens in a lot of advanced body works is you want to get a better grip on the connective tissues themselves. And so you learn how to work both with lubricant and without, which really gives you a much greater therapeutic range. Oh, and then they make those sounds that are pretty good. And the deep massage we teach is quite distinct from what's normally taught as deep tissue, which is basically oftentimes deep Swedish massage. We are very, very conscious and somewhat unique in saying what I need to do is learn how to touch the person in such a way that they can actually relax inside themselves, which makes it a lot less hard work for me and actually much less painful for the client. Matter of fact, not at all painful, more pleasurable. I like to say, sometimes people say, you can't hurt me, or you need to hurt me in order to get rid of this pain. You don't need to hurt people to get rid of pain. That's kind of like saying, you should take poison in order to get over a toxicity. I mean, it's ridiculous. Anyhow, the stages to really engage the person are you center yourself, get into a good body mechanical posture, and bring your attention to what you're doing. Take out the looseness in the soft tissue so the person really feels you're there. Take up the slack. When you do that, you start to feel the bone underneath the muscle. So now you've engaged all the muscles. And then I'm going to begin the movement. And the quality of movement needs to be one where the person senses that you have some curiosity in your hands. You're not just doing something mechanical. So I'm feeling, as I'm working with Peg, I'm feeling a little more tension in one side, and then on the other side I'm feeling a little bit more tension. And I shift my weight to address if there's a little more tension on the right or the left at different spinal levels. And I take this all the way down to lengthen the whole spine. This one stroke usually feels so good that you could virtually do it for a whole massage. And the person would be like, yeah, how's that? Oh, could you do that about 700 times? So you definitely do it a few times. Notice that also the body mechanics result in vastly less effort for me. I'm just relaxing my knees for my pressure rather than pushing with my shoulder girdle. That's really critical. Working down the sacrum and then starting to work into the lower back. We talked about layers of muscle. There's 3 layers of muscle in the lower back. And what I want to do is come into the sides of them And in a sophisticated approach to back massage, what you learn is that if you're going to address the back muscles, you need to come in not onto the back, but you actually need to come into the side. And I'm addressing not only the erector spinae, but deep to it, the muscle called the multifidus, and then deep to that, the muscle called the quadratus lumborum. This starts to then really substantially reduce the back tension that people are walking around with, whether they're athletes or older people or just anybody. And most people are tense in these muscles. It's like most people's backs are problems waiting to happen, unfortunately. The next thing we do is come up to the level of the back muscles that are just at the bottom of the rib cage and going all the way up eventually to the back of the head. We call this ironing up the erectors because this works with kind of smoothing out the out of shape or out of kinky feeling that we get in the back at the end of the day when you just feel that tension lodged in your back. So this just irons it out and smooths it out so that we're adding length to the whole spine. Later in the session I would also work with lengthening the front torso so there's really a three-dimensional sense of decompression. And then I come in underneath the shoulder to kind of open up the front of the shoulder girdle, through the back, and here through trapezius and a deeper muscle called supraspinatus. And often I'll do these strokes once, twice, or three times, depending on the amount of tension I find. As my partner says, oftentimes the deeper you want to go, the slower you need to go, which also is relaxing in terms of its pace for your client as well as you as a therapist. Oftentimes after working, the therapist says, you know, I feel so much better. And there aren't that many forms of health care where you seem to actually feel better as a result of doing it. In this case, you do inevitably feel better. So now I'm going to be working on the opposite side. You always work bilaterally. How's that, Peg?
Good.
As I work, I carefully watch my own body mechanics. And also, you talked about looking at kind of energetic issues. Mm-hmm. What I'm doing is I'm bringing my awareness right to where my elbow is. I'm not trying to kind of push my energy into them. I'm not letting their energy come into me. I'm really making a good meeting, good, clear meeting. And by having that visualization of a good, clear meeting, it helps things be clear for both people, extremely clear from the get-go. So some of those ideas are ones that I've taken from zero balancing, which is a very sophisticated approach that you work with the physical structure of the body as well as the energy. And that's become incorporated with something that makes this demassage largely method, quite distinctive. The more my heart is in my work, the more I'm thinking clearly about the anatomy, the more I'm relaxing my legs, the more I'm making a clear communication as well as manipulation with the hands, the more the person feels extraordinarily invited to let go from inside out. And that's really the goal. I can relax them from outside in, but that's not going to last. If they relax from inside out, they've gained a neurological skill. And everybody needs that ability to be amplified by their therapist. Just a little introduction to looking at anatomy and looking at deep massage as we practice it. And it's a real honor to be able to present that level of work to you and to your clients. Big thanks a lot.
Thank you. That was great. Fist down the erectors.
Yeah.
Amen.